Welcome to this video, which will show you what you must do in order to clean your teeth properly and remove plaque so that orthodontic treatment can be provided safely and that your teeth and gums remain healthy. Please watch this video carefully, as your orthodontist may ask you questions about what you have seen so that they can help keep your mouth healthy during treatment and minimize any risks of treatment. To clean your teeth properly, you will need a toothbrush. This can be either electric or manual, an interdental brush. This is used to clean between the teeth, an interspace brush, which is used to clean the sides of the brackets and underneath the wire, as well as disclosing tablets, which are used to stain the plaque so that it can be seen and then removed. We cannot start treatment unless the teeth and gums are healthy, and you're able to remove plaque from the gum line, all the surfaces of the teeth, as well as in between the teeth. Not having good cleaning habits can result in gum disease and permanent chalky or brown marks on the teeth, which is called decalcification. If we feel that you are at high risk of decalcification, then the brace may need to be removed early to prevent damage to your teeth. This can mean the treatment is left unfinished and your teeth may actually look worse than at the start of treatment. You must clean your teeth in front of a mirror so that you can see the brace and your teeth clearly and are able to remove any food or plaque that has collected in hard to reach areas. We will start by using an interspace brush. This is designed to get underneath the wire and clean the sides of the brackets where plaque can gather. It's important that every single gap between two brackets is cleaned with this brush and that it is wiped up and down the sides of the brackets. Next, we will use an interdental brush. This small brush goes in between the teeth and removes any plaque that has collected there. Not doing this can cause the gums to swell and bleed, and it means that the spaces don't close or are more difficult to close, which makes treatment take much longer. Please note the colours red and blue, as your orthodontist might ask you what they were to ensure that you have watched this video in full. They can also help you choose the right interdental brush sizes for you, but most patients should start with a size 1 brush. This is orange for the TP brand. You then work up to the largest brush that can easily fit in the gap between two teeth. The very last thing you use is a toothbrush, and either an electric toothbrush or a manual toothbrush can be used, and we'll show you both. You start in the upper teeth and angle the toothbrush so that the bristles are aimed at the gum line. Now this is where the gum meets the tooth, and you must make sure that the bristles are getting around the wire and actually touching the gum line. Once the gum line of the top teeth has been cleaned, the bristles are then aimed under the wire, making sure to start at the back of the mouth on one side and then move tooth by tooth to the other side of the mouth, making sure that not a single tooth is missed. You should make sure that the bristles are actually getting under the wire and cleaning the lower surface of the bracket. There can be some bleeding or some soreness if this has not been done properly for some time, but this will stop once you start doing it regularly. We then repeat this process for the lower teeth, starting at the back and aiming the toothbrush at the gum line, making sure that the bristles are touching the gums and starting from one side of the mouth, working to the other side, not missing a single tooth. Once the gum line is clean, we then aim the bristles under the wire and clean from one side of the mouth, again to the other side. So now that we've cleaned the outer surfaces of the upper and lower teeth, we then move to the inner surfaces. These are the ones that are closest to the tongue, and we start at one side of the mouth and work our way to the other, making sure every single tooth has been cleaned. It's again really important to make sure that the bristles are touching the gum line and scraping along the gum line to remove any plaque in this area. The same process can be performed with a manual toothbrush, but here we use side-to-side movements to make sure that one or two teeth are cleaned together at any one time. You must use the same order that we showed for the electric toothbrush, making sure no area is missed and paying particular attention to the gum line, underneath the wire and around the brackets. If you have any temporary anchorage devices, also called mini screws or pins, then you must make sure that these are kept clean as well as the area around them. If you're going to use an electric toothbrush, please turn it off before you clean the mini screws, as otherwise it can loosen them. To summarize the key points, proper cleaning is essential for safe orthodontic treatment. You must use an interspace brush, an interdental brush and a toothbrush, and follow the full process that we have shown in this video. You must keep these brushes to hand so that you can complete this whole process when you're away from home. Thank you for watching this video, and your orthodontist will be more than happy to answer any questions that you may have.